Hey guys, hi. Thank you if you are coming in listening to my live. I have not come in a while to talk to y'all, but y'all, this is a burning issue on my mind and I could not let another day pass. I'm going to talk about the young lady named Brittany Watts in Warren, Ohio, who faced a grand jury for charges that were placed upon her for felony abuse of a corpse after coming into the hospital with a miscarriage, y'all. So that's what we're going to talk about today. We're going to talk about the case revolving Warren, Ohio, which is outside of Youngstown, Ohio, which is a very rural area, where Brittany Watts, a young lady, 34-year-old African-American female, was charged last year with felony abuse of a corpse. Now, the outcome of the case has been determined, but I just kind of want to talk about what happened and how this can happen to any woman in the post-Roe Wade era. So we all know about Roe versus Wade, 1973, where basically it was legalized, that abortion was legalized, okay? And therefore it was a woman's choice, and she could choose an abortion for her health care. And in most states that was up to about 12 weeks, and you could venture to some states and have an abortion up to 20 or 23 weeks. Okay, so we know that was reversed, right? We can talk more about that. However, that was reversed. And so let's just talk about this young lady, Miss Brittany Watts. My understanding was she came into the emergency room at this hospital. I believe it, I'm not even going to say the name of the hospital because I don't want someone to cite it and I have it wrong. So she came into the hospital and was determined that her water broke, and it was at 22 weeks. So that is a condition with which we call PPROM, okay? And, different OBs and different medical providers have different meanings for the P's, but what I use is, we're going to use preterm rupture of membranes. That means that her water broke before she was termed. So we know a term pregnancy is 37 weeks, and her water broke at 22 weeks. Now, if anyone has went through a miscarriage, we know that is a second trimester miscarriage. And we also know that if you have counseling from the NICU, so let's say what would normally happen for a woman in this case. She comes into the hospital and she's experienced, we're going to call it PROM instead of PPROM. I won't even confuse everyone. So preterm rupture of membrane, so less than 37 weeks, we will get something called a NICU consult. So the neonatal intensive care unit physician or nurse practitioner or someone, that they've delegated will come and talk to the patient about the prognosis of their pregnancy. And the OBGYN will also speak with them, but how many people or many women or families will use the prognosis of the pregnancy, so how the potential outcomes of the pregnancy, to determine how they want to move forward, okay? And so they will talk to you about viability and the outcome or the probability that this fetus will live. Now, I will say over 10 years ago when I finished training, the probability of the life of a 22-weeker was very, very low. It is still low today. However, I believe it is higher. So a lot of times hospitals will I need to restate that. Let's just say that a lot of hospitals will be called resuscitation at about 23 and 5, 23 and 6. So, and at some hospitals, it may initiate in the 22nd week. What does that mean? That means that the patient has been counseled and they understand that the prognosis or the possibility that this child may be born living, even with multiple comorbidities, such as, cerebral palsy, hemorrhaging, we call it intraventricular hemorrhage. So, seizures, bleeding on the brain. We know that the lungs won't be developed, immaturity of the gut, respiratory distress. So the list goes on. And we know that this child will likely be dependent on an adult for the rest of their life. So that counseling does occur, correct? So, my point in saying that is if you come in at 22 weeks and your water is broke, the chances of survival are low. And so therefore you will be counseled by a NICU, lower than, let's say, at 37 weeks. So you'll be counseled by a NICU professional. So this young lady, Brittany Watts, came into the hospital. Her water was broke. And just to give you what I've read and listened to, she was told that there's a high chance that her fetus may not live. Her pregnancy, would not result in a viable pregnancy, would not go to term. And therefore, what usually happens at that time is if the fetus does have a heartbeat, the OBGYN will then talk to possibly risk management or the ethics committee at the hospital. What does that mean? That means that there is, and Georgia has laws around this, and all states will have rules around this, is that if the pregnancy, if the fetus is at risk, so let's say the mom is hemorrhaging, her water has broke, there's an infection. If there is a documented reason that the risk of prolonging the pregnancy, even if it has a heart rate, increases the risk of death to the mother, then oftentimes you can proceed with an abortion. So those laws are different from state to state, and I recommend you talk to your provider about them. So my understanding is that's what was occurring with Miss Watts. So there was an 8-hour period from her coming into the hospital to them making their decision. And that decision, like I said, will often involve the ethics committee, risk management, because you don't want to be sued and you want to do what's for the laws of that, or what's agreed upon for the laws of that state, correct? So during that time frame, Miss Watts left the hospital, which is fine. I mean, you have the right to leave the hospital. Waiting 8 hours is she may have had other kids at home. She may have had something else that she wanted to attend to. And one thing I think that brings an important point across is that if a woman does miscarry, if her life is not at risk, she does not have to stay in the hospital. Some women will miscarry full term. Hi, Alicia. Thanks for listening in. Some women will miscarry full term and still decide to leave the hospital, because if their life is not at risk, then they can make their decision at another hospital with another provider, or let the process happen naturally. So Miss Watts decided to leave the hospital. And so at the hospital, she had a documented ultrasound with the documented live fetus with a heart rate, and the water was broke. When she left the hospital, she went home, she miscarried, she returned to the hospital. Maybe she had bleeding. Maybe she had wanted to report to. Oh, actually, what happened? She returned to the hospital, I believe. When she returned to the hospital, the medical care providers did an ultrasound and saw that she was no longer pregnant. So if you have a live fetus with a heartbeat, and then you come back in and you have one without a heartbeat or no fetus at all, the provider, I'm not even going to say who it is. Some of the hospital staff decided to call the police. Once they called the police, they said, and the recording, the 911 call is available online. She states that there was a woman who come to the hospital. She had basically a live fetus. Her water had broke. She went home, and when she came back, she was no longer pregnant. So that opened up the concerns for the fellow. Well, let me continue. So the police went to her home, and that's where they determined that the plumbing system was blocked, and found out that it was blocked by a fetus, and she was therefore charged with felony abuse of a corpse. So there's so many issues that go on there that were triggered by the initial call from the hospital staff that there was a concern that she was no longer pregnant. Had that phone call have never been made, then the police most likely would not have went to her home to find out that the plumbing system had been plugged up by a fetus. Now, let me state, as I've seen online as well, people miscarry in the toilet all the time. People deliver full-term babies in the toilet. I'm not going to say it happens all the time, but it does. If your water breaks or you're in labor and you go and you think you're having a bowel movement, I've had it happen in a hospital. where I've had people with a bedside commode next to their bed. They think they're having a bowel movement. They push down, boom, and the baby comes out. So this is not a very uncommon occurrence. So basically, my entire reason for bringing up this live is that there is the fact that she was charged for a felony abuse. So first of all, I think what I really want to talk about is the process. We talked about the process that people come in, they can be hemorrhaging, they can be infected, their water can break, and there's just a great chance that their pregnancy will not progress. So if she was 35 weeks, they would have proceeded towards delivery. Okay. But, the fact that she's 22 weeks, you want to weigh the risk of delivery versus the risk to the mom and the fetus. So they were making a decision, and during that decision, she left. So this is a process that can happen anywhere. Okay. She could have been admitted to the hospital, which it sounds like she was, and she could have decided to watch and wait. She was all within her rights to actually leave the hospital. Okay. I just think that this was kind of a domino effect from that initial phone call that occurred from the hospital staff stating that she was pregnant when she left, and then when she came back, she was no longer pregnant. So I think that women, it really, as an OBGYN, the fact that women are being villainized for decisions that they make around their body, I think that is something that, of course, the court system needs to look at. However, I don't want to go around pushing my views upon anyone or in this situation, because, of course, these are my views on social media. These do not reflect the views of anyone that I work for, I work with, or anything like that. But I just want every woman to understand that this could have been them. And I want them to understand why this occurred. It didn't necessarily occur because she went, what was stated in the media is that it did not occur because she miscarried. It happened because she allowed the fetus to end up in the plumbing system. So what could have been, let me tell you another way that this could have played out. Miss Watts, or any woman who this happens to, if they are aware that they miscarry, what you can do is you can retrieve the fetus or whatever you obtain that came out of your body. You can put it in a container and you can take it back to the hospital. I know that sounds very kind of just archaic and things of that sort. However, that can possibly, this could have prevented those charges having been brought upon her. But I do want anyone to understand that if you miscarry at 22 weeks, oftentimes the fetus will come out breathing, but we don't anticipate without support that the fetus will continue to breathe. And even with support, meaning intubation, putting a tube down the throat, et cetera, there's low probability that the fetus will live a normal life or progress to a full-term fetus in the NICU, or, infant in the NICU. So those are just my views. And if anyone finds themselves in this type of situation, just things that they could do, you could stay in the hospital and let that decision be made while you're in the hospital. However, you do have the right to leave the hospital. And if you do miscarry at home, which can happen, save the contents of your uterus, save what you miscarried if you're able to. Some people, and I will state, aren't even aware that they miscarried. You flush the toilet, things are gone. Okay. She may have had a sharp pain and not known that she miscarried and flushed the toilet without knowing. So there's just so many things that could have happened. And I also want to state that when a fetus, this is just, an aside, because I think this is important as women miscarry. Notice that as a fetus loses oxygen or starts to loses its blood supply, say the placenta, oftentimes it will start to deteriorate and break down. So that may be, a reason why she was not aware. It may not have came out as a full fetus. It may have started breaking down. So talk to your healthcare provider, and it is my hope that women have the right to discuss this with their healthcare provider without the intervention of various auxiliary systems, because there's the doctor-patient relationship can never be replaced. Okay, y'all. Thank you for coming and listening to me. Even if you listen to this after hours or later on, please like, share, and I appreciate you for following me. Thank you.